All right, so depression. If we talk about depression, it is definitely one of the most common mental illnesses found in human beings. Basically, what happens is there's mental disturbance, there's typically a lack of energy and a difficulty in maintaining concentration. One of the marked symptoms is a lack of interest in life, so normal activities. It tends to afflict around 20% of the worldwide population. Women are much more likely than men to fall victim to depression, so 2 to 3 times more likely to experience depression. It also tends to run in families, so for genetic reasons or others, depression runs in families. According to Statistics Canada, if we look at the latest survey in 2012, we can see that 5.4% of the Canadian population over the age of 15 had symptoms that met the criteria for mood disorder in the previous year. Almost 1 in 8 adults identified symptoms that met the criteria for mood disorder at some point during their lifetime, including 11% for depression. So again, very common. When we screen for depression, typically we're using a test that's called the PHQ-9, and basically it looks at some of the key symptoms that people would be experiencing if they were depressed. And then of course the scoring reflects how often those symptoms are being experienced. The PHQ-9 is nice because depending on the score, they recommend specific actions. So someone that has a low score would be in the normal range, so normal mood, or in full remission from having depression. As the score increases, more advanced treatments are recommended, and in some cases, treatment with antidepressants, psychotherapy, especially if there's not been improvements in the past. So some of the most common symptoms of depression, feeling helpless and hopeless are some of the 2 key things. Often there's going to be feeling useless, inadequate, bad, self-hatred, constant questioning of thoughts and action, an overwhelming need for reassurance. Those people tend to be vulnerable and oversensitive. They often feel guilty. There's a loss of energy and motivation that makes even the simplest task or decision very difficult. So simple daily activities become impossible. There's a very significant risk of self-harm. Often there's going to be weight fluctuation. Either those patients will gain weight or lose weight. Typically very difficult to sleep, or there's an excessive desire to sleep. So same as with mood, people will experience either extreme. There's agitation and restlessness. There's a loss of sex drive. People are finding it impossible to concentrate. There's a sense of unreality, so it feels like you're not in your body, you're not experiencing things normally. In severe depression, there's often going to be suicidal ideation, there's failure to eat or drink, and there can even be delusions and or hallucinations in very serious cases. The 2 key signs in terms of depression are loss of interest in things you like to do and sadness or irritability. Males often experience anger, so men tend to feel more anger versus more sadness for women. There's often changes in behavior. Generally, those people will slow down, they'll neglect their responsibilities and their appearance. Poor memory, very difficult in terms of concentrating. Like I said before, there can be suicidal ideation and difficulty in making decisions, of course. The leading theories, we think that basically what's happening is there's genes at play and there's a life situation that triggers the depression. The vulnerability causes the mood regulating system to fail when life stresses exceed the person's ability to cope with them. So it's a combination of our genetic material with a situation that's happening in our life. Depression and sadness are different in the sense that sadness is a normal part of life. Depression is not. Sadness is basically feeling of sorrow or unhappiness. They have similar reactions, except that depression will last longer. So sadness is usually temporary. Depression can affect someone's mood, cause them to feel drained, and cause someone to feel down for weeks, even months. Sadness is usually not that long, and eventually you get over it. Some of the risk factors for depression, having had depression before, of course, is a very strong risk factor. More than 50% of people who have had one case of major depression will experience a recurrence. Stress has been viewed as a major risk factor for depression, so again, high stress is often going to be the trigger. Recent research also suggests that stress may only predispose individuals for an initial episode, but not for the recurring episodes. Some of the associated medical conditions that we often see with depression. So there's usually a strong association between chronic medical conditions and an increased risk of major depression. It was the same for anxiety. So being physically ill increases the risk of mental illness, obviously. Several chronic medical conditions contribute to depression. So stroke, heart disease, obesity, Parkinson's, Alzheimer's, epilepsy, arthritis, cancer, AIDS, COPD are all examples of chronic medical conditions that increase the risk of depression. Some of the things that you should be avoiding if you're depressed: don't make long-term commitments or important decisions. Don't assume things are hopeless. Don't engage in emotional reasoning. So because I feel awful, my life is terrible. You want to avoid those types of associations. You don't want to assume responsibility for events which are outside of your control. So again, guilt can be a part of depression, and so we want to avoid that. And don't avoid treatments as a way of coping. So often, again, there's stigma and reluctance to seek help. Depression is highly treatable, so seeking help is one of the first things that you should do. As for anxiety, talk therapy is key. So cognitive behavioral therapy is the most studied and is an effective treatment for depression. Basically, it helps people correct negative thought patterns and better adapt to the world around them. And of course, one of the key benefits of talk therapy is that it carries very few risk, far less than medication. Lifestyle, also really, really important. So you want to have a regular routine. Most people with depression lack a goal for the future and a routine to accomplish it. So trying to basically incorporate a routine in your life really helps with depression. You want to set some goals. When depressed, it becomes difficult to accomplish anything. So set simple goals at first. For example, getting proper rest, eating 3 meals a day, simple things that you can work towards. You want to exercise. Exercise is one of the most important things for mood, especially in depression. Proper nutrition, again, absolutely essential. You want to get proper rest as well. Right attitude is also really important. You want to take on some limited responsibilities. You want to stay involved. That will help you counter the depression. Change how you think. So you need to challenge negative thoughts before they get out of control. So that's also really, really important. People with depression tend to have a more negative outlook on things. You want to try something new, get out of your rut, and you want to make time for things you enjoy. So prioritize time that's going to be dedicated for rest, exercise, proper nutrition, and to see friends. Natural treatments for depression. So there's several dietary supplements that have good research supporting their use in depression. They include St. John's wort. So short-term studies suggest that St. John's wort is more effective than placebo and just as effective as tricyclic antidepressants in the treatment of mild to moderate major depression. There's also short-term responses if we look at how effective it is. So typically between 65 and 100%. In the long term, the response rate is a little bit lower, but still around 60 to 70%, which is very good. Caution is advised when taking St. John's wort, because there can be interactions with many drugs. So again, talking to health professionals is a good idea. Typical dosage is going to be around 1,200 to 1,800 milligrams per day. Fish oil is another supplement that's been shown to help prevent depression and improve overall emotional well-being. It's been shown in large studies that people that have a diet that is rich in omega-3 oils are less likely to experience symptoms of depression. So fish oil is one of those things that, again, is going to be really effective for people suffering from mood disorders. Increasing omega-3 fatty acid intake enhances many aspects of brain function, including the control of mood and aspects of personality. So fish oil help in terms of how our neurotransmitters work, and that's why they're so helpful for mood disorders. In terms of the dosage, typically the dosage used in clinical studies is between 1 and 4 grams per day. And so that's typically what's going to be recommended. Another supplement that's used for depression is folate. Folate is basically part of the group of B vitamins. Many studies show that an elevated incidence of folate deficiency is seen in patients with depression. And reviews show that studies show that by giving folate, we help to improve outcomes in patients that are already receiving antidepressants. The likely mechanism is basically that folate is involved in the production of serotonin, which is a neurotransmitter, so a chemical in our brain that helps to improve mood. Dosage, so recent studies looking at the results in people that have been using folate supplements, we basically see that a dosage of around 1 milligram a day is typically what's going to be effective in terms of improving mood in patients that are already on antidepressants and suffering from depression. Another supplement that's often used is called SAMe. SAMe is basically a protein and an amino acid called methionine. And basically it reduces depression scores in 4 of 5 small randomized controlled trials. And basically patients receiving SAMe saw improvements. We saw improvements in 36% of patients receiving SAMe versus 18% of patients receiving a placebo. So twice as effective basically as not receiving a treatment. It works quickly, so that's one of the key things with SAMe. Typically, when we use medication for depression, it takes several weeks before the medication starts to improve mood. SAMe works more quickly. In depression, basically the effect is similar, again, to tricyclic antidepressants and far greater than placebo. The mechanism of action is still poorly understood, but we do know that SAMe has an effect on monoamine metabolism, which increases serotonin and norepinephrine. So again, 2 neurotransmitters that are important for energy and mood. The other thing that we know is that vitamin B12 or folate deficiency are known to decrease the levels of SAMe, and that increases the risk of depression. In terms of dosage, studies typically have used between 200 and 1,600 milligrams per day. Others have used more, up to 3 grams per day in some trials. Vitamin D, of course, also really, really important. We think that lower levels of vitamin D in the blood will increase the risk of depression. We also think that seasonal affective disorder is linked to lower exposure to the sun and lower vitamin D levels in the wintertime. Research study in 2008 that was done in Norway found that people with a low level of vitamin D in their blood had more symptoms of depression. They also found that taking vitamin D, particularly in large amounts, improved those symptoms. The biggest effect happened in those people with more severe symptoms. Our own research showed the same benefits here at Pure North, and the evidence suggests that vitamin D levels above 100 nanomoles per liter are going to be beneficial for depression.